NOC Care. Thank you a lot. And we will have also André Gonçalves, please join us from ZOR. Okay, just a few seconds. It's okay, Sergio? Okay, so let's start with, I think, NOC Care. José, please. So, the presentation? You don't have the presentation?
It's over there. It's called José Bastos. I can see it here.
José Bastos.
Yes.
It's there. José Bastos already spotted. Is that?
Yes.
Okay, thank you. Please.
Hi, everybody. I'm José Bastos. I'm one of the co-founders and CEO of NOC Healthcare. And I'll just give you some quick highlights about the company. So we are specialized in telemedicine. We're the market leaders in Portugal, and we're present in quite a few countries already. Over the last 12 months, we've done over 160,000 appointments, and well, you can see the other figures. Although I think that this one and the 12 countries we're present in are the two key factors, with over 5 million people that are already covered and using our technology. Our vision for the company is that we're building on the data that we gathered from hundreds of thousands of appointments to make NOC the most effective tool in the world of digital-first healthcare. And I think the key message that I want to leave here is that healthcare is shifting towards a digital-first, and it's those tools that are going to be the tools that will deliver what's coming in the future. So people, and this has been discussed before, they always, or they think of telemedicine as a Zoom on steroids option, and we're thinking it's quite a lot more than that, because through the data that we gather in non-invasive, easy to use and low cost solutions, as demonstrated by Valerie even before, you can do so much more with data and telemedicine and deliver such a great result to the patients. And additionally, we believe that with the approach of the 5G, data will become even more ubiquitous. And so the patients and ultimately everybody will gather even more of their own data and make a better usage of it. So our challenge for us is, are we talking about healthcare or sick care? And we see so many people with chronic conditions and joint chronic conditions that I think the challenge for a player in this space is to develop technology that helps migrating from sick care to healthcare. So I'll let you know a little bit more about what we're doing. You know, how can we help? So we have evolved a lot since we started, and I'll just give you a quick overview of what we do. So we have scheduling, we have integrated symptom checker with AI to help directing the patients to the right points, payments in countries or systems where co-payments are required, a lot of checks before the consultation starts that basically guarantees that over 98% of the people who try to join a video consultation using our technology do so successfully. And 35% of our patients are over 65 years old. So it's even agnostic in terms of age. And ultimately, they join the video consultation, individual and group, they share files, they share information. From the doctor's side, we have an electronic health record that has already ICD-10 codification, coding, and e-prescription integrated. So also what that means is that it's very simple, very intuitive for doctors, so they will not waste a lot of time in admin processes. They just use this and it works, and we store all of this data. This is, of course, one of the challenges that we're very interested in for the future, and one of the things that we are really looking forward to going into the market. And we believe that once we have this well figured out, everybody, and even the most vulnerable, as in our previous panel were discussed, will have access to much better quality of data. And so for us, this is also very critical to be able to empower the most vulnerable using our technology. So basically, and in a nutshell, what we're doing is we're collecting 28 data points in every single consultation. Right now, we're still not collecting 28, but in hopefully 3 months' time, we will be collecting actually more than 28 already. And this has massive impacts in costs for users, in costs for the payers, in quality of service for the providers, and in quality of experience for the patients. And kind of this is what we focus on. So this is a fully integrated and customizable platform. And we have a specific example of the sort of costs that we are able to cut by people using our technology. So, how can we improve on what we already have? Well, a lot. We've been reading about this study in the US that during a period of 12 months in 2017 and 2018, they've measured risk scores for cardiovascular disease at the beginning and 12 months later using technology to keep up with those patients. And basically, the two key findings are 16% of the people there was a decrease in 16 percentage points in the risks and 8% reduction in mortality. And how? Well, the key here is to identify risks before they're visible to everybody. So I'm going to share you real NOC data so that you see the kind of work that we're doing and what we're aiming for. So these are actual data from our patients, and you will see that 5% of them have hypertension episodes. And by looking at that, I'm now going to explain what we do in hypertension. So we know who they are. We know how they're distributed by age group. We know the incidence that they have over age group. And so we invite this target population to use screenings to answer some health scores. And once they do that, and once they do that, we know if they are real patients with hypertension or only acute one-off episodes. And once we separate the false positives from the real positives, we keep asking them for more information. I can't switch. So we have this program that has a number of endpoints, a frequency, and a number of questionnaires where we gather all of this information from patients, basically incentivizing them to measure, to change their behavior, to adopt their behavior, to take their medicine, and to measure how they're performing. And with a number of reasonably simple questionnaires and a lot of clinical information on the background and a lot of clinical work on the background, we are basically able to change the cost of managing a potential hypertension risk patient from the risk of an acute episode to actually a cost of 20 euros per month, and that person will be monitored and will keep up with us. And we are right now only focused on hypertension, although we're already developing tools for diabetes, high blood fat, smoking, obesity, and physical inactivity. We believe that these costs are material. We believe that by using this and based on the patients that we've been measuring, we can deliver a return on investment of over 80% in the first year. And this keeps growing and evolving for the future. So we have our own framework for all of these programs. And this is basically our North Star. What do we do with data? It has to be reliable, it's research directed, and it's relevant for the patients, for the doctors. And once we deliver this, we have this very valuable USP of using predictive information to actually prevent to flag the patients even before acute episodes happen. We have, as everybody here, a lot of certifications. We're working on many others just to make sure that everything works perfectly. We have operational dashboards for the patient, for the manager of the health network, and a lot of operational dashboards regarding the clinical information for the patient, anonymized, secure, but it's actionable. So this means that our clients and our patients can very much benefit from actionable information. And I think we help anybody with two challenges: the challenge of scale. How large are the teams of the companies that are working on this versus our own? And the challenge of speed. How fast can they get this up and running versus working with us? And we have already a number of global insurance and healthcare businesses in 4 continents. And this was basically what I wanted to bring you. So thank you so much.
Okay. Thank you, José, for your synthesis capacity. Okay. And right now, André, if you be so kind.
Hello all, good afternoon. Thank you very much for the invitation to participate in this summit. I will try to be synthetic because the day is long and we are with a little bit delay. My name is André Gonçalves. I came from the temperature monitoring unit of the ZOR group, more specifically ZOR Thermal. Today, I came to speak a little bit about the data that I came to speak is about temperature. So, we are a company that is, for the last 20 years, is focused on the development, design, and test and qualify of solutions that maintain temperature, product temperature. They are specific for thermosensitive products. So in the last pandemic gave all the world a little bit of aware of the importance of temperature to products due to the vaccines that everybody of us was all day in the TV speaking about the temperature of the different temperatures of vaccines. And this is what we do for the last 20 years. I will not focus, of course, today in the thermal chain, in the solutions that we developed to transport blood, to transport pharmaceutical, to transport the backpacks, etc. I will focus mainly on the systems that monitorize temperature. And along the years, we had 20 years ago systems that were basically manual or visual systems that were reactive. Then they passed to wired systems that gave, and they were semi-automatics. And then through times they passed to wireless systems. And now the systems that monitorize temperature in fridges, in incubators, in every equipment that are in hospitals and in pharmaceuticals, and present days, they can accomplish the technology and can transmit data, do Bluetooth, do LoRa technology, do many ways. So this is what I'm going to be focused on. In the last 15 years, we were pioneers in installing wireless temperature monitoring systems in hospitals and in a pharmaceutical environment. And this gave a lot of flexibility to hospitals and to public sectors due to their constant extensions, constant changes in installation, in growth. So I came here with some facts just to enlighten the importance of temperature in products, in thermosensitive products. So the pharma industry loses approximately $35 billion annually due to failures in temperature, in logistics, in warehouses. As much as 35% of vaccines shipped all over the world are wasted because they are transported or too low or too high in terms of temperature. This is a worldwide view, and more specifically, even to the field, to Portugal or to the countries. For example, a medical refrigerator should not be filled with more than 75%, and you know that this is many times does not happen. And for example, standard domestic refrigerators cannot be used for storing cold chain products. So in that way, in the last 15 years, we worked in the field with several international providers of wireless temperature systems. And there is a quite specific reality in the field, in the hospitals mainly, that several services need temperature control and temperature monitoring in different specific scales. So this, all the services, since a pharmaceutical service, the blood banks, the immunotherapies, the labs, for the transport, different needs in the same hospital with different hierarchies and different users. So brings for the temperature sensors and the temperature data a very difficult situation to be safe and secure. So in the past, and I will tell in the recent past, what was pretended in temperature was the archives, the data reading, the history of through times of temperature, of fridges, of incubators. At any time, if I'm a service nurse or a service coordinator, if I want to know real-time data of a fridge, I could have. Most important, the alarms and the alerts given at the right moment. This is very important, and mainly to meet the requirements and the standards of the sector, that is the good distribution practice and the privacy. I brought, this was the past and this recent past, and is not applied in the field today in all places, but I brought a little view for the future that of 3 operations that we have implemented in terms of temperature monitoring in Portugal, that they go through a little bit more than that was happening today. For example, with a provider of blood that brings blood from the blood center to the hospital and delivers to the hospital in a, how we call a smart solution, that is a bag that assures that the temperature of the blood is secure. And inside of that bag, there is sensors, and those sensors will assure to this provider that the blood is delivered to the hospital. And in that moment, he knows immediately, just with his smartphone, if the temperature of the blood that he's delivering is correct. Okay, this brought to the transport chain the full traceability of it. Another example, and this is very hard for a country like Portugal, that is a region with a hospital, a general hospital, and with several healthcare centers. So we have a very specific reality in this, because in a hospital, if it's full of technicians, coordinators, directors, everything, and the same hospital can control 20 healthcare centers that are in the smallest village of the region. But the necessity of the temperature is the same for both. And with wireless sensors, with different responsibilities and different information for different people, we can assure the temperature of the whole region. I cannot ask to a simple nurse in a simple village that is focused on his job to understand a wireless system that is not part of his of Earth tasks. And another different, and that is in the pharmaceutical distributors. In the beginning of this whole chain, it's possible to, with monitoring system, to connect the monitoring system to the AVAC system that controls all the warehouse. So all information can be all around the warehouse, giving data for the AVAC system to put more heat or less heat in terms of the chain. So present, future, now, maintaining all the past issues that I spoke about, this system should be represent the full traceability in terms of temperature. So knowing that that a vaccine or a product, from the beginning, from the production until the patient, you can report in this file the temperature that occurred during all the process. Of course, in hospitals, the IoT and the interface with the hospital, because if we have a big hospital, they will not want to have another system, another software of a monitoring system for the fridge. So to be open for them to integrate in their platform. of course, being more friendly for the technology, for a smartphone or with a app format. And what you all were speaking about, much better than we can analyze, is advanced analytics for us to understand if the temperature information could be included in all this information. Thank you very much.
Thank you, Andre. I would like to give the congratulations again to José Baix from Nokia and also André Gonçalves from ZOR. If you want to contact them, you can talk to them at the Health Innovation Village in the exhibition area, or contact through their normal channels. Paulo, let me know about the time now. It's a break. Okay, so we will take 10 minutes. 5 minutes. 5 minutes break, and we will return. Okay, thank you very much.